Good morning friends, myself Dr. Vijay, plastic and cosmetic surgeon from Zenith Clinic. Today in this video I am talking about circumcision surgery. Circumcision it's a surgical procedure where we remove excess preputial foreskin. It's generally done for a clinical condition known as phimosis. Phimosis, sometimes it is congenital, it is present right from the childhood, and sometimes it happens in adulthood, mainly in the diabetic patients. So, though what happens in phimosis, the preputial skin they cannot retract back over the glands. So, what happens eventually over the long period of time? So, instead because of lack of cleaning and all, so they may suffer from repeated infections. Called we usually call it as a melanoprostatitis. And few other indications for circumcision are like we do it for some religious purposes in children's, and we also do it for a cosmetic reasons to improve the external appearance of the glands and penis. And also we do it for some other clinical indications, those who have repeated STDs and other infections. And let's see how what options we have. Traditionally, there used to be an open surgical option, like we used to cut the excess skin using a knife and then suture it back after cutting the excess skin. It used to be a lengthy procedure and traumatic procedure, and the drawback of this open technique was used to be like time consuming, lengthy recovery, and used to be a lot of tissue handling and a lot of stitches we have to take, and we used to have a lot of swelling. People used to have a pain for a long time. And so to combat all these things, we have a latest technique, that is ZSR circumcision. So now we routinely do ZSR circumcision, which is very safe, very simple, and very fast. So let's see benefits of ZSR circumcision. See, it's hardly 5 minutes procedure. So there is no much of tissue handling. So therefore there is no much of swelling, there is no much of pain in the post-op period, and there is no lengthy recovery. So almost in 5 minutes your procedure is done. So what happens in ZSR is actually along with it's basically a stapler circumcision. What happens when along with the cutting of the skin, this ZSR stapler, what it does, it also simultaneously seals the cut edges. So there will not be any bleeding, and there will not be any swelling, there will not be any excess pain. So hardly 1 or 2 ml of blood will be lost. Otherwise there is absolutely bloodless. And recovery also, it will be very rapid. And almost next day you will be doing every activities and you will not have any pain. Minimal pain that can be manageable with analgesics, what we advise for 3 days or 5 days, sometimes 7 days. And dressings, will advise dressing only for 24 hours. After that you can take out the dressing and you take bath, and you can wet the surgical area, and then you can use a small dressing material. We usually give a ointment, so you can use the dressing. So this is how our ZSR technique, ZSR circumcision, as simple as that. So anything you want to know more about ZSR circumcision, are you looking for a ZSR circumcision surgery, please contact our team. Our team will help you and clear your all doubts.